So today Nursing Times and Health Service Journal hosted a roundtable event on wound care and wound care management. Specifically, we were looking at some of the issues that most challenge organisations when they're providing wound care. What are the barriers to great wound care? What are the challenges around resourcing, staffing? It was really interesting because we had people here who were nurses, alongside people from the world of finance in the NHS, and also organisations came along that wanted to talk about the work that they'd been doing in wound care. So it was great to combine the clinicians and the other people from other parts of the organisation to talk about how they should all work together and contribute their specialisms, their skills, their experience in order to provide a better service for patients around the issue of wound care.
We have to get a better understanding about the impact of wound care across the health economy. If we don't know what the health economy issues are for our locality, then we don't know where to put our resources or our energy.
Getting that information locally and painting that picture for my CCGs, my trust board, my patients, my clinicians, and say, you know, this is where we're at and this is where we could be. But we can only be there with investment, not just monetary, people.
And maybe how do you get that actionable data? So it's not just data, it's actual information that you can genuinely deliver care on. And that'll be what gets it on the radar of the top table. I think one of the things is the collaborative approach. We misalign some of our incentives at the moment. I'd like to get it so everybody works together for the benefits of patients.
All the work that you've got to do, and how do you change the minds of others within the healthcare service, whether it be acute or community, to put these things on the agenda, to make them a priority.
With the right approach, you not only make a difference to the people that you work with, but you actually can make a difference and impact on the system that you work with too.
If we're going to invest, then we need to know where the savings will be, and there will be savings. It's quite straightforward. It will be savings around infection, around admission, quality of life, but actually there are in-year savings there for the picking if you look in the right place.
I'm really interested in what you mentioned about prevention and what can we do and how can we release funding from the pathway to move into prevention to hopefully have a long-term outcome of less patients with wounds.
What's been interesting today is in the conversation, I think we've touched on all the three main themes of 5-year forward view in relation to this particular topic, which is prevention and health. We talked a lot about. We've talked particularly about quality of services and the financial issues that go with it. And I think there's an onus, I think, on all organisations to go back and have a look at what is happening with wound care issues within their areas.
There is a consensus of view that change needs to come, and that change can be delivered by working together.
We've got lack of staff, lack of education, lack of knowledge out there, and we've now got to think about, right, what do we do next? How could we move this forward? Could we prevent these wounds from happening in the first place? Could we do something? It's not always about the product. It's actually saying, right, we've got a higher comorbidity population, we have staffing issues, we can't carry on the way we're doing. So we've got to think of something innovative, forward thinking. We've got to work with industry, we've got to work with our providers and our commissioners to say, okay, what can we do next?